Hello, we are learning about calcium channel blockers. Calcium channel blockers like nifedipine and so on. So, calcium channel blockers are widely used for many diseases. And if we look at some examples of calcium channel blockers, include felodipine, which is a brand name of Fulpic, Adalat, um, which is the brand name for nifedipine, Tildem, or Adizem for diltiazem and amlodipine. So they are widely used for hypertension, angina, and so on. So, before learning about calcium channel blockers, it's really important that you know basically that you have a basic understanding of the role of calcium in the contraction of myocardial cells, the myocytes, and the smooth muscle um, cells which line the blood vessels. So there's a magic. It's really wonderful physiology. It's beautiful. Basically, when the action potential reaches the myocytes, there's a coupling of the the neuron or the conducting cells firing up, and then first sodium ions rush into the cells, and then the immediately the L-type calcium channels are open, and then this plateau phase of the heart contraction is what causes the rush of calcium into the cells, and then the sarcoplasm, which is the store of calcium inside the cell, is released, which this mechanism is known as calcium induced calcium release, which basically releases more calcium into the cell. And what all these causes is it increases the contractility of the myocytes, and it's also dependent on the smooth cells which line blood vessels to contract and then increase the blood pressure. So if you interfere with the rush of calcium into the cells, you can basically reduce the time it takes for the heart to contract. You reduce the contractility of the heart. So a lot of the mechanism of calcium channel blockers is understood by just learning about this beautiful physiological role of calcium in the conduction of electrical signal within the heart, and its role on the muscle itself. So if you look here at an animation of the heart, which I recorded from Wikipedia. It's really beautiful. It shows the electrical signal is starting at the sinoatrial node, and then when this happens, sodium is released. As soon as sodium is released and the cell is activated, there's a rush of calcium ions into the cells, which cause the contraction of the heart. It basically increases the force of contraction, and then increasing the amount of time it takes for the heart to repolarize again and getting ready for the next action potential. So the net effect of interfering with this with the role of calcium is basically reducing the heart rate. Remember, if you reduce the plateau phase here, if you interfere with the calcium rush into the cell, you basically reduce the amount of time it takes for the heart I mean the contractility of the heart, and then that actually reduces the heart rate. And if you remember, it's used for blood pressure and angina and other things, as we said. So the blood pressure goes down. Angina is basically it's a plug which forms in the arteries, the coronary arteries. So basically, you reduce the need um, for more oxygen and blood supply to the heart. So the blood vessels also wall resistance reduced because you block the entry of calcium into the cell, so you interfere with it. So the the vessel wall is relaxed, so there's less resistance, so the heart can pump um, blood more smoothly. And as we said, the energy needs of the heart is reduced, so relieving symptoms of angina. So they are also divided into two groups, some known as dihydropyridine calcium channel blockers and non-dihydropyridine calcium channel blockers. So the non-dihydropyridines include verapamil with the brand name of Securon and diltiazem. Um, Diltiazem, which is also known as with a brand name of Tildem or Adizem, and also the dihydropyridines, which include nifedipine, amlodipine, felodipine, nimodipine, and so on. So, main indication, as we said, it's used to reduce and prevent, hypertension complications. It's used for angina, where the atherosclerotic plaques have blocked the arteries to relieve the energy needs of the heart, and it's also used for tachycardias and arrhythmias, because remember, non-dihydropyridine calcium channel blockers block the rush of calcium into the cell, especially at the atrioventricular node, and thus reducing the heart rate. And the problem with arrhythmias is usually fast heart rate, like atrial fibrillation, and the more dangerous form of ventricular fibrillation. So if you reduce the heart rate, so basically you relieve the symptoms of arrhythmias or the tachycardias. So, but beware, for if you use calcium channel blockers, especially verapamil and diltiazem in a heart failure, basically when the heart muscle is unable to pump blood effectively, it stiffens, or it becomes hypertrophic. So you need to avoid non-dihydropyridines in heart failure, because it may depress the failing myocardium further and then cause asystole. So you also need to avoid drug using with drugs that cause bradycardia, especially beta blockers and dilti and verapamil is very dangerous combination, and diltiazem as well. You also need to avoid digoxin and amiodarone unless it's under a specialist care. Um, Side effects is no brainer. Basically, they reduce the blood pressure, so symptoms like flushing, lethargy, headache. Verapamil, you need to be very careful with constipation or treat with some laxatives. Also, some of them might cause angioedema and anaphylaxis reaction, so you need to keep that in mind as with all medicines. Also, remember using two drugs which reduce the blood pressure, like alpha blockers or phosphodiesterase type 5 blockers like sildenafil or doxazosine. So basically, they may cause enhanced hypotensive effect. So you need to avoid them. Also, as we said with beta blockers, you need to avoid sudden withdrawal, because this may cause a rebound failing of the heart, causing more problems and complications. So as you can see, some calcium channel blockers are enzyme inhibitors, so they have many interactions like with other enzyme inducers and enzyme inhibitors like clarithromycin, rifampicin, phenobarbital, basically anti-epileptic drugs and macrolides, some statins, some anti-HIV drugs, and as we said, all the enzyme inducing anti-epileptic drugs like primidone, phenytoin, and carbamazepine. So, and also theophylline is very important, that you take that into account, that using calcium channel blockers might increase the concentration of theophylline in the blood, which has a narrow therapeutic index.